I'm San Francisco Mayor London Breed, and I want to thank the press for joining us virtually, as well as Dr. Grant Koufax with the Department of Public Health and other members from our hospital community, including UCSF and Dignity. As many of you know, this has been a very challenging situation, not only for San Francisco, but throughout our country. We declared a state of emergency back in February, on February 25th of this year, to begin the process to prepare for what we know was coming. As of today, we're at 172 cases in San Francisco. We see that continue to rise every single day, and when we look at states all over the country, we know that the early steps we took to not only be prepared, but also to ask people to stay at home has definitely had an impact on the numbers that we are seeing every single day. But we also know that, as Dr. Koufax mentioned on Monday, it is still going to continue to climb. Sadly, things are going to get worse, and it's important that we continue to stay at home because it truly does mean that we save lives as a result. We have been working to make sure that we identify the existing resources that we have in our healthcare system and that we look to increase our capacity so that when that surge hits in San Francisco, that we are prepared. But if the numbers hit the way that they are going in a place like New York, there is really going to be a challenge with our system. And when you think about it, San Francisco has many hospitals. We have some of the best health care anywhere. We are in probably a better situation than most, but we are still in a situation that requires a significant ramp up. And it requires the need for our state and our federal partners to step up more than they ever have before and to move faster. We see that there have been a lot of challenges with the federal government, but I am grateful for the stimulus package that just passed last night, and I'm hopeful that that money makes its way to the people of this city so that folks can survive. But I also hope that it provides us the much needed support that we need in our hospital system so that we are able to prepare and for the number of beds that we clearly will need during this crisis. Right now, we have about 1,300 medical surgical beds and 200 ICU beds. We definitely need a lot more than that, and we know that many of our hospital partners have been really stepping up and significantly increasing their capacity to help meet the need. This is not as easy as opening up a bed. It also requires that we have nurses, we have doctors, we have healthcare professionals, and we have sufficient PPE to keep them safe, as well as support the patients that we're here to serve. We estimate that we will need more. It's not even a question as to whether or not we'll need more. And so we are grateful to the governor and the work that he's continuing to do, but we definitely will need more. We estimate that we will need about 5,000 more hospital beds on top of what we already have, and at least 1,500 ventilators to address this very significant challenge. We know that it's important to make sure that we're ready, that we're prepared, and we also know that if people who are out on the streets continue to congregate with one another, continue to interact with one another, which increases the spread of this virus, we will not have enough beds, enough ICU units, enough ventilators to support the people that we know are going to need them. That's what this is about. That's why you're hearing from all over the world to stay at home, to stay within your respective home with your respective relatives so that we can do everything we can to prevent the spread of this virus. We are going to do everything we can to get our hospital community ready, and it definitely has not been easy. We're doing everything we can to acquire a number of hotel rooms to help house those who are unsheltered and to also help those who live in congregate settings so that they're not sharing bathrooms and they're able to live independently and separate from others, that they live in the single room occupancy hotels, our SROs. We are setting up a system so that we can keep people apart from one another to prevent the spread. And this has been a real challenge, especially with our homeless population. And we will continue to work hard, and we'll have further details about some of our plans moving forward. As I said, made a request to our state and federal officials. I sent a letter today to Governor Gavin Newsom, as well as our Vice President, Mike Pence, who's in charge of the task force leading this effort, making it clear what we need. This is not the first time we've reached out to make it clear that there is a significant need in our health system, and I hope that it will be the last, and I hope that they will deliver for the people of this state and the people of this country, because time cannot be wasted on interactions that don't lead to the kinds of results that we need. We need to be prepared to save lives. We need to be prepared to take patients right away. And we need to be prepared with the capacity necessary in order to help people. And so I want to thank the Hospital Council and our great partners for continuing to work with us in the hospital community, the private sector, the public sector. We are working collaboratively around the challenges that we all face with testing, the challenges with PPE, the challenges that we know will continue to get to a point where we are going to have to keep working together at this, supporting one another, because we know that clearly at this point the numbers will continue to rise. There will continue to be people who need to be hospitalized. And I want us to keep in mind that we don't want to turn anyone away. Think about when you're out there and you're socializing and you're not socially distancing from one another, the difference that could make and the spread that occurs as a result of your interactions with other people. And if you went to the hospital because you were sick, or a relative or a family member, and they were turned away because we didn't have enough beds to accommodate them, we don't want to get to that point. And so again, my plea is to ask the public to continue to cooperate, to continue to exercise social distancing, to be responsible for one another, because we're in this together. We are all responsible for one another, and whether or not this virus spreads more than what we are seeing, we can see a difference by making sure that we do our part. And so I want to express my appreciation to the majority of San Franciscans who are following this order, and who are providing helpful tips to people of things that they should and shouldn't do. We have a list of frequently asked questions on our websites. We're trying to do everything we can to outreach to businesses and individuals about what this means. The police chief and members of the San Francisco Police Department are out there doing their very best to address challenges with crime and to educate the public as to why this is important. Everyone has a role to play in keeping our city safe and healthy, and I appreciate everything that you all have done and will continue to do to get us to that point. And so with that, I want to take this opportunity to introduce Dr. Grant Koufax with the Department of Public Health to provide us with an update and the collaborative efforts between the San Francisco Department of Public Health and our Hospital Council and the various hospitals that exist here in San Francisco.
Thank you, Mayor. Good afternoon. I am Dr. Grant Koufax, Director of Health for San Francisco. Over a week ago, Mayor Breed and several Bay Area counties announced an unprecedented order requiring residents to stay at home in order to slow down the spread of the coronavirus. Since then, many other counties and the state of California have issued the same instructions, as have multiple places across the country. I want to take this opportunity to thank everyone who is taking this order seriously, and as seriously as this situation calls for. Your efforts to stay home and maintain social distance is and will save lives. I want to emphasize that. Social distancing is and will save lives. I know there are people out there who would lead you to believe that our efforts are too aggressive, but I cannot stress enough just how vital they are. As of this morning, San Francisco has over 170 confirmed cases of coronavirus. Just 3 weeks ago, we had 2. We expect these numbers to continue to rise rapidly. And sadly, we have now reported our first death from this disease. On behalf of the Department of Public Health, I extend my condolences to this man's loved ones. And I am sorry to say that the worst is yet to come. And yet we are preparing, as we have since the very beginning of this emergency. The hospitals in our city have tried to empty as many hospital beds as possible to make room for the patients that are coming. Currently, there are about 1,300 staffed regular beds across all San Francisco hospitals and about 200 staffed ICU, intensive care unit beds. These beds have appropriate staffing and supplies today to care for all patients who need that level of care, including coronavirus patients. This number of beds could handle an initial surge of coronavirus patients as well. In less than 2 weeks, we expect a surge of people needing hospitalization. So our goal now is to, again, flatten the curve so fewer people get sick at once. This will reduce the likelihood that our healthcare system gets overwhelmed. The last thing we want, is for those who need care to not be able to access it. Every hospital in the city wants to care for everyone who needs our help. That is why we must stay vigilant and recommit ourselves to staying home and leave the home only for essential reasons. Again, the health of our community depends on it. Now, as we are preparing for the surge of coronavirus patients who need to be hospitalized, I want to let all San Franciscans know that all hospitals in the city are working together on an unprecedented and unified response. Our work is being improved and supported by predictive modeling of the disease spread and the potential effectiveness of our interventions. It will help us envision various scenarios based on data, science, and facts from the coronavirus locally, across the nation, and the Bay Area. We are working with some of the world's top public health experts, epidemiologists, infectious disease and global health experts based in the Bay Area, including at the San Francisco Department of Public Health, UCSF, and UC Berkeley. Our work to prepare for the hospital surge is happening in 2 parts. First, as much as possible, we are lowering the number of patients we see in our healthcare system and admit to our hospitals. We need to continue to make room for a surge of sicker patients. As I have said, and the mayor emphasized, we have ordered all San Franciscans and Bay Area residents to stay home. We've restricted visitors to hospitals, long-term care facilities, and residential facilities to protect the health of vulnerable populations. These are by health order. We have canceled or postponed elective surgeries and routine medical appointments and moved services to telephone and video conference. These are being done under a health order. We have provided places other than hospitals for people with suspected or confirmed cases of coronavirus to remain safe and isolated, to free up hospital beds and hospital staff. We have ordered enhanced cleaning of SROs, expanded shelter hours, and more meals served to shelters and navigation centers to improve the health and safety of vulnerable populations in an effort to further reduce hospitalizations. The second part of getting ready for a surge of corona cases is the work all the hospitals in San Francisco are doing together to increase capacity. A new floor just for coronavirus patients is being readied at St. Francis Memorial Hospital that is staffed and equipped through contributions from St. Francis, Zuckerberg, San Francisco General, and UCSF. We've made the hiring of DPH, Department of Public Health nurses, faster and easier, and this has already resulted in adding over 80 new nurses to this collective effort. We are obtaining more supplies and equipment that we need most, including personal protective equipment, or PPE. And we are growing our capacity to test. We are now processing dozens of tests per day and waiting as little as 24 hours for results. Our top priority is the health of our patients, our community, and the people who care for them. I want all the people in our community to know we are doing the very best we can to be as prepared as we can be in fighting this disease. But I must look across the nation to New York City, and I continue to be concerned. It is plausible that despite all these efforts, we could have a scenario similar to the one that is playing out in New York this very day. If that happens, our capacity, our surge capacity, will be far exceeded. Look at what is happening in New York. An excellent medical system, superb scientists, frontline, brave, courageous nurses and doctors, and a capacity to respond to normal and even urgent activities is being overwhelmed. In that situation, we estimate we will require over 1,500 ventilators and 5,000 additional medical and surge beds. In that scenario, we will require federal and state assistance. We cannot manage that alone. So, as I close my remarks today, I want to address all San Franciscans as honestly and directly as I can. Every day, people you may not even know are exposing themselves to risk and working the hardest and doing their best to protect you and keep you healthy. Our healthcare workers, our first responders. If you aren't performing an essential task to keep our city running right now, then you have only one job. That is, please stay at home and keep everyone safe. By staying apart, we stand together. Thank you. And it is now my pleasure to introduce Dr. David Klein, President and CEO of St. Francis and St. Mary's Hospital, and Chair of the Hospital Commission for San Francisco. Hospital Council of San Francisco. Thank you.
Good afternoon. And Mayor Breed and Dr. Colfax, thank you so much for your leadership. As chair of the Hospital Council, I'd first like to thank all of our caregivers in the city who keep our community safe. These are indeed unprecedented times that we're all experiencing together. And there has never been a more important time for our hospitals to work together. And I am grateful to be here in San Francisco, where our many health systems have a long history of partnering to keep San Franciscans healthy. At Dignity Health and St. Francis Memorial, like so many other hospitals across the state and the world, we have shifted our focus towards caring for those affected by COVID-19. St. Francis is very proud to provide a dedicated unit for this important work. The unit will open in early April, and we will be staffed initially through a partnership with Dignity Health, UCSF Health, and Zuckerberg San Francisco General Hospital. We, too, are supporting social distancing. We are encouraging our employees to work from home whenever possible. We're supporting social distancing as much as we can within the hospital and encouraging our patients to see physicians through virtual visits instead of in person when that's possible. A public health issue of this magnitude must be addressed with creative solutions. The Hospital Council has been working to identify these solutions since the very beginning of this crisis. No one hospital can do this alone. The only response is a collective response, and I am grateful that this collaborative effort to create a dedicated center for COVID-19 patients will help ensure hospital care is available to anyone that needs it. I applaud the efforts of the Hospital Council, the San Francisco Department of Public Health, UCSF, and the Mayor's Office to look to the future and to ensure our community has the necessary resources to prepare for whatever comes our way. Working together, we will flatten this pandemic curve. Thank you. It's my pleasure now to introduce Mark Larrett, the President and CEO of UCSF Health. Thank you.
Thank you, Dr. Klein. 20 seconds. But I won't take the full 20 without talking. Mayor Breed, I want to thank you for your courage and your leadership, setting an example for this nation about getting in front of the issues associated with this virus and taking the bold actions that hopefully will help us flatten the curve. And Dr. Colfax, I want to similarly express my gratitude to you for your leadership in helping all San Francisco be aware of the issues the risks that we're facing and helping us through that. One of the greatest strengths of San Francisco is our sense of community. When there's an issue, when there's a problem, we all step up together to face it. We have a long history of doing this across all sectors. And today I want to talk about particularly how the hospital community has stepped forward to address the issues that Dr. Colfax just outlined. We know we need vastly more hospital beds. We know we need vastly more testing capability. We know we need to move to telehealth visits. And over the last several weeks, the hospitals in this city have dramatically reduced their census, dramatically reduced inpatient elective surgeries, and dramatically increased the number of telehealth visits. And as I was driving over here today, I heard that today, for the first time ever at UCSF, we took care of more outpatients via telehealth than we did in person, a true moment of recognition of an important change. Every hospital in San Francisco is doing its part. Kaiser was the first to have a drive-through testing center. Sutter Health, CPMC, is looking at ways to expand their capacity. Chinese Hospital, the VA, everybody has moved forward to look for ways that we can address the needs of our particular community. At UCSF, we are planning to reopen our Mount Zion Hospital by May 1st, hopefully sooner, to expand our capacity by at least another 50 to 60 beds. But I particularly want to talk today about St. Francis Medical Center because Dr. Klein showed extraordinary leadership in saying, we will make space available. We don't have the staff, we don't have the physician staff, we may not have the resources to make this unit operational in time. But that's where all the other hospitals in San Francisco stepped forward. And led by Dr. Susan Ehrlich, the president and CEO of Zuckerberg San Francisco General, we all got together and talked how we could contribute. UCSF will contribute members of the medical staff, and we've made a $1 million commitment to help support the costs associated with reopening that unit. Sutter, Kaiser, Chinese Hospital are all also stepping up and trying to help in any way they can to make this unit a success. Because as we all succeed together, it benefits us all, but we all have to come together in order to achieve that. Let me just say, too, that I've spent a lot of time thinking about silver linings. I just mentioned one. We're doing more telehealth visits than ever before. But one of the other silver linings is that members of the hospital community in San Francisco are now working more closely together than maybe they ever have. The chief operating officers, the chief nursing officers, the directors of pharmacy are all working together to figure out how we can provide services and support to each other, share resources as needed, and improve the well-being of all of the members of our community. As Dr. Klein mentioned and Dr. Colfax, we've been tapping into resources that we didn't even know we would ever need. The brilliant people at UC Berkeley working with our scientists at UCSF on modeling. The Chan Zuckerberg BioHub initiative has been an enormous help in making equipment and expertise available to help us improving our testing. Scientists at UCSF working not only on new testing approaches, but also on new treatments. And most of all, I want to acknowledge our strong community of supporters, people who are interested in making sure that San Francisco is always a community, people who've stepped forward with contacts, people who've stepped forward taking their N95s and depositing them in a place so they can be used by healthcare workers, and people who've made financial contributions to help us through this difficult time. We must flatten the curve. We must get in front of this epidemic. We are going to face very hard times in the coming weeks. But if we do the basic things that Dr. Colfax talked about, washing our hands, keeping our distance, and staying home, we can do our part to help this community succeed. So thank you, and I'll turn it now back to Mayor Breed.
Why not? Clean up the whole thing. So thank you, everyone, again, for your partnership and your support and the work that we are all doing together to get through this crisis. And at this time, we want to open it up to questions, and I also want to acknowledge that we have here with us as well the Department of Emergency Management Director, Mary Ellen Carroll. We have the Police Chief, Bill Scott, is here, and the Director of the Department of Human Services, Trent Rohrer, is here. So with that, happy to open it up to any questions.
Okay, this is the Public Information Officer. I'm going to go ahead and call on you. First question, Dominic, San Francisco Chronicle, question and follow-up.
Yes, thank you. Question first. Could someone talk a little bit more about the mechanics of the unified plan, details like how resources will be apportioned as they come in and who's calling the shot as these resources come in? Thank you.
So I think either Mary Ellen Carroll or Dr. Colfax, one of you want to address that? Okay.
I have to bring it down. Thank you, Mary Ellen Carroll, Department of Emergency Management. So here at Moscone South, where the city's Emergency Operations Center is located, we are centralizing resource acquisition and purchasing and distribution. We are working hand in hand with the Department of Public Health to both identify the resources that are needed and to make the appropriate purchases and also requests for aid through the state and the federal government. As we look at so the Public Health Department will be our link to our partners here to determine the overall city needs. All of that will be centralized here through the Emergency Operations Center, and we will work through our existing system in order to ensure that we both are aware of what our needs are, what our burn rates are as we use it, and what we need to come in where our gaps are.
Dominic, do you have a follow-up?
Yes. I just also, I guess, just a question about the modeling. With New York sort of being the test case, if you will, or something that fed into how San Francisco's plan came together, can someone just speak a little bit about how that modeling worked or what some of the inputs were to determine how much would be needed if San Francisco starts to look more like New York State? Thank you.
So, thank you. This is Grant Colfax. So the model has been developed by UC Berkeley clinicians, physicians, and epidemiologists and research scientists, and it's basically looking at scenarios that happened already in Wuhan, China, also data from Italy, and our local data. And using information that's coming in from New York to provide a number of scenarios to better understand plausible scenarios with regard to where we are headed in the next few weeks and the next few months. The model takes information, again, from all these sources and then makes certain assumptions that we do not know to be true, but are plausible based on other data to better understand where we are and where we may be going. The model with regard to New York, that's really based on what New York is experiencing and their specific resource needs right now with regard to ventilators and hospital beds. So that is really focused on if, and it's still plausible, it's certainly plausible, San Francisco does not succeed in flattening the curve and gets to a place where New York is, we estimate at this point we would need at least 1,500 ventilators in our system and additional 5,000 medical surge beds. There are other estimates that if our shelter in place and other interventions are working, that we would not get to that point. But I want to stress that we are doing everything we can with the partners here today under Mayor Breed's leadership, with the collaboration and leadership of Mary Ellen Carroll's Department of Emergency Management, to be as prepared as we can be locally. But there are plausible scenarios that would put us in a state like in a situation like New York is in, and making it very clear that our resource capacity, our local resource capacity, would be far exceeded and require state and or federal help. Thank you.
Next question, Liz, ABC 7. Liz, are you on the line? ABC 7. Okay, I'm going to move on. Wilson, KPIX. Wilson, KPIX, next question.
Hey, thank you. A question about timing, and I understand the projections are always changing. You mentioned seeing the surge in less than 2 weeks. Can you put that in some more context? As you understand that path now, can you tell us what it looks like in terms of, I guess it's sharpness, for lack of a better word, and more importantly, the duration? Is that, if that's the start in less than 2 weeks, what kind of a timeline?
I cannot give you a specific timeline at this point. I'm basing the surge information based, if you look at the curves in New York right now, if you looked at what happened in Wuhan, China, the curves are very steep. Trying to get as specific as you're asking for, we simply cannot do. We are tracking the data to see what the plausible scenarios are. And in terms of how long this will be, we really don't have an answer to that because remember, we're doing a shelter in place right now. We are hoping that that's effective. We need everybody to stay at home to save lives. If that works, that will greatly decelerate the curve and flatten the curve. We will know over the next few weeks whether we see signs of that happening. The other piece, though, from a public health perspective, following the science, data, and facts, is that those efforts need to be sustained over time because you could get an initial, you could flatten the curve initially, but then if things go back to normal, that curve could very easily go back up. Thank you.
Wilson, follow-up.
All set. Thank you very much.
Okay, I'm going to go back to Liz, KG07. Liz, KG07. Okay, I'm going to go to Kate, KQED. Kate, KQED. Okay, I'm going to go with Mission Local. Nope. Okay, Christian Cafton, KTVU. Christian, you there? Okay.
Yes, I'm here.
Okay, go ahead.
Yes, I think what's happening, people are watching.
Okay,
my question.
Go ahead.
Wondering what is being done
Okay, Christian, you're cutting in and out, so I'm going to move on.
The Honda and 850 Bryant. Heard about a number of cases at 850 Bryant, a number of cases that Honda have done to try to on those.
Okay, Christian, we didn't get that, so I'm going to move on. Why don't we go Gordon, New York Times. Gordon, New York Times. Julio, Univision. Jackson, NBC Bay Area.
Right, can you hear me?
We can hear you.
Dr. Colfax or whoever chooses to answer this, we understand that some UCSF physicians are seeking, the pulmonary and critical care specialists are seeking everyone in the public facilities run by UCSF or staffed by UCSF for everyone there to wear at least surgical masks to protect against the spread. What's the current response to that? We're led to believe that at least at SF General, the answer has been not yet or no.
This is Mark Larrett from UCSF. There's been a lot of work on the science around the spread of COVID-19, and the predominant science belief is that this is droplet spread, not aerosolized, except in certain procedures when it is aerosolized. And so the approach has been to use droplet and contact precautions rather than aerosol precautions. We're still learning a lot about the disease and a lot about the transmission. The ideal approach that we would use would be to have plenty of PPE, personal protective equipment, for every employee. But the fact of the matter is that we're working under pretty intense shortages right now. And so we're trying to make sure that we're giving the appropriate PPE to those physicians, nurses, and other staff who are in circumstances where they actually need it. And we're trying to reserve our supplies for those individuals. But over time, as we get additional stockpiles of masks, gowns, gloves, hoods, and so forth, we will try to expand the circumstances under which those are utilized.
Jackson, do you have a follow-up question?
Yes. I think Kristen was going to try to deal with this, the issue of 5 sheriff's deputies and 1 cadet involved in screening at City Hall have showed signs. Are you guys concerned about people at City Hall? There are 1,000 people a day went into City Hall until you guys closed it up recently. Just wondering, have you done any outreach? I mean, people hold weddings there and all sorts of things until recently.
Jackson, can you turn down your YouTube? We cannot understand your question. Jackson, can you turn down your YouTube feed? We cannot understand your question.
Basically, you understand a screener at City Hall has tested positive, a cadet at SF Sheriff's Department, and can you hear me now?
We can hear you now.
Okay, so the screener has tested positive, and we were just wondering what's been the fallout from that. Do we have any idea how many people might have had the potential of being exposed? And
Jackson, you really have to turn down your YouTube stream because you've got to mute it because you're coming in choppy. As I understand it, your question is what is being done for screening at City Hall?
What is being what?
Done regarding screening at City Hall because some sheriff deputies have tested positive for COVID-19.
I didn't catch that. I'm sorry. Can you repeat?
I'm going to repeat your question as I understand it. You're asking about sheriff's deputies that have tested positive for COVID-19 at City Hall, and if there's anything being done differently at City Hall for screening.
Well, to notify people as well, yes.
Dr. Colfax is here to answer your question.
So just, again, we are following all recommendations and protocols per the CDC with regard to exposures, whether they are in City Hall, whether they are in any other institution. We are working with the Sheriff's Office and with City Hall representatives to make sure that all appropriate precautions are being taken. People exposed high risk of exposure are given the education materials they need, and people who are testing positive, again, are following proper medical guidelines for protecting themselves and protecting others. I want to emphasize that overall in the community, the most important thing is that we provide, that we continue to social distance and only the most essential workers be at work. Our first responders are on the front lines, and it is our priority at the health department to ensure that they and their leadership get all the information they need. And in the case of exposures or a positive test, the right public health procedures are being followed based on science, data, and facts.
Okay, I'm going to go ahead and read Liz's question from KGO. We know in New York some hospitals have banned partners during childbirth. Is that something being considered in San Francisco?
So we issued an order severely restricting visitors to a health order restricting visitors to all hospitals, all but the most essential visitors were allowed in. We think that this is based on public health, and we think that further restricting at this point is not necessary. Thank you.
I'm also going to read Christian Captain's question. What is being done to crack down on hotspots, including 850 Bryant, where there have been a number of cases, and Laguna Honda?
So with regard to Laguna Honda, from the very beginning, as early as the declaration of emergency, Laguna Honda has been a key focus of the health department's efforts. As you know, we've focused on ensuring that we do everything we can to protect vulnerable populations. And we have the best infectious disease control experts, the best clinicians, the best people looking at hygiene at the wards and with our patients and with the staff at Laguna Honda. We have taken a number of steps, including screening staff, ensuring that they are not exhibiting symptoms of illness. We have had major restrictions in visitors visitors. We are issuing a health order to not allow patients to be leaving Laguna Honda later today. That order will be, that order has been issued today. And we're ensuring that staff have the protection they need based on CDC guidelines to provide the care that they need. If a patient does test positive at Laguna Honda Hospital, we will follow all the proper guidelines. I think people know that a number of staff have tested positive for COVID-19 who work at Laguna Honda. The areas where the neighborhoods where they work, the units where they work are on quarantine, and all proper precautions are being taken at this time. And I will let, with regard, there was a follow-up question to that, I believe. 850 Bryant. The 850 Bryant question, and Chief Scott will answer that part of the question. Thank you.
So for 850 Bryant, the San Francisco Police Department had 2 of our employees to test positive for COVID-19 at 850 Bryant. We have quarantined 24 officers, 27 total employees from that unit, 25 sworn and 2 non-sworn employees. We have sanitized that work location, and we had already restricted some of our workforce from being in the office. We've broken up our investigative units into details, so we are rotating them from telecommuting to working in the office when it's essential to actually working out in the field, which we announced the other day. We've been in contact with Sheriff Miyamoto. I know he has a number of staff at 850 Bryant. The courts have restricted their court activity to basically all essential court activity. I just got an email just as I was listening to the mayor about some jury trials have been postponed, so it's the same concept that Dr. Colfax and others have been preaching: social distancing, limiting the amount of people in a confined space, and that's what we're practicing. So we hope that that will have a difference and limit the exposure to our workforce. Thank you.
Okay, I'm going to read the next question from Mission Local. We keep hearing from our Hispanic community that they are afraid of getting tested or going through drive-through because of their legal status, despite the president saying they would and should be tested and treated. But I think it would be beneficial for the community to hear from our local leaders how safe are undocumented and uninsured Latinos to get tested.
Grant Colfax, Department of Health. So I just want to emphasize that the health department takes care of everybody regardless of immigration status. We are a city and a department of compassion, and that nobody will be discriminated against based on immigration status. San Francisco is a sanctuary city, and people who need care should avail themselves of the care across the city's health department. If you meet criteria for being tested for COVID-19, you should be tested. We will test you. We will take care of you.
Okay, next question. Alexander, San Francisco Business Times. Alexander, San Francisco Business Times.
Hi, can you hear me all right?
We hear you. Go ahead.
All right. So I wanted to see if there's, maybe Trent could answer this, but I wanted to see if there's any update on the hotel situation in terms of the number of rooms being proposed in response to the RFP last week. And also, if Trent could clarify, at the press conference on Monday, there was, it wasn't quite clear whether he was supporting hygiene stations for homeless people on the streets or putting them in hotel rooms. And I guess you could speak a little bit more about how the situation's changed.
Hi, Trent Rohr, Executive Director, Human Services Agency. We have completed lease-up, executed leases for over 300 rooms. We're currently working with the Department of Public Health to move homeless individuals or others who cannot self-quarantine out of the hospital and into these isolation rooms. This is our primary #1 focus in preparation for a potential surge. The hospital needs these beds, and the individuals that are in them now do not need to be hospitalized. They're simply there because they cannot quarantine. We have entered our second phase of leasing with 8 hotels totaling 920 rooms. We have assessed all of those hotels for their suitability, and we'll be entering into agreements as soon as we can come to the lease terms with the hotel owners. With respect to individuals who are on the street, the priority must remain to keep the hospital beds open for the potential surge. The second priority must be to thin out our existing homeless shelters, meaning creating social distancing within those shelters. As part of that plan, we're targeting the vulnerable individuals in our homeless shelters. These are people who are age 60 or older or with underlying health conditions. They will be prioritized, if they can self-care, will be prioritized for some of our smaller hotel rooms. In addition, we are bringing on an integrated care shelter at Moscone North. That will be for individuals who cannot self-care, and that will be basically a medical shelter to provide the medical supports in a congregate way and a safe way for individuals who can't self-care in hotel rooms. With respect to individuals on the street, we continue to promote social distancing with our homeless outreach teams. In addition, we are setting up hygiene stations for them as well. When we encounter vulnerable populations on the street, and once our integrated care shelter is activated, should those individuals need to move indoors to seek medical care, we would do that. Should they be equipped to manage themselves in a room into self-care, they would be placed in one of our medically supported smaller hotel rooms.
Okay, I'm going to go ahead and read the question from Kate from KQED. What will the capacity of the new ward at St. Francis Memorial Hospital be? How many people will be able to be treated?
This is David Klein from St. Francis. So we have the ability to take care of 40 medical surgical patients on the unit and an additional 8 in a critical care unit that's two floors above that. Our plan is to initially open up 10 beds, which will be available the first week of April, and then we can grow very rapidly from there. So I would say the total capacity using the critical care unit and the med surgery unit will be 48 patients.
Okay, next question is from Goran, New York Times. Have we reached the stage where every San Franciscan can get tested as soon as they experience symptoms and not just higher risk patients? That's the first question. Again, the question is, have we reached the stage where every San Franciscan can get tested as soon as they experience symptoms and not just higher risk patients?
So we know that there's a national shortage of testing for COVID-19. We are rapidly escalating our testing abilities here in San Francisco. Right now, among our partners at our public health lab, with UCSF, and with the Chan Zuckerberg BioHub, we've dramatically escalated our testing just from last week. We are now, among those combined groups, able to do tests over 400 a day, and those are the rapid tests. I think one of the key things in this testing discussion that's really key is turning tests around in a day or 2 days is really vital to better understanding how to care for patients and where we are in the epidemic. These other tests that are being escalated, some of them take a turnaround time as much as 6 or 7 days. And as you know, from what we're seeing across the country and across the world, that is just insufficient for us to be able to respond to the epidemic. We are working with key partners across the city to escalate so that everybody who has symptoms consistent with coronavirus can get tested and know their status. We have also issued a health order as of yesterday that required all testing agencies in the city to report the number of positive tests, the total number of tests that they are doing, the total number of positive tests, and the total number of negative tests. This is an unprecedented effort to better understand the testing capacity across the city and understanding where we need to focus and scale up our testing efforts.
Okay, that was the last question. Thank you, everybody. This concludes our press conference.